below the knee. Some people may even complain to you and causes the brain song waves from coming to the tympanic membrane. In the child, more commonly, is the fact of having an ear infection, either a middle ear infection or an external ear infection that causes the tympanic membrane to be damaged. Also, in addition to that, the tympanic membrane can be damaged by a foreign body or from infection within the middle ear. Now, that pressure within the middle ear, the only way it can escape is via the tympanic membrane. We get a rupture of the tympanic membrane. Now, it doesn't oscillate as well. It doesn't transmit the songs as well, and hence it results in deafness as well. There is difference between a neurologic deafness and deafness due to auditory deafness, and this basically is due to sound waves itself. So we can have deafness as early as it is in the auditory canal, or we can also have deafness due to the tympanic membrane. In cases in which the auditory ossicles are not able, the malleus, the incus, the stapes, are not able to vibrate and amplify the sound, especially because a lot of cases with us with high cholesterol levels, they actually fuse, or chronic ear infection, which occur here, can cause these to fuse, so there's no amplification of the sound, and we can result in deafness here. We can lose our sense of balance because here is where the cochlea, here is where the semicircular canals, which have levels of fluid within them, and movement of the oval window causes the fluid inside of the scala vestibula and the scala tympani to move. Those movements of fluid is what controls our balancing. If that is affected, whether due to an infection, what tends to happen is you move your head and you figure the room is moving as well. In a normal individual, the brain interprets movement of the head, the fluid level alters, but the brain transmits that as saying the head is moved, not the room is moved. In a case of Meniere's disease, or in cases in which you have evidence of infection involving the semicircular canal, you get the sensation that you're moving, the ground is uneven. You also get the sensation that in addition to the deafness, you get the dizziness and the vertigo as if the room is spinning on itself. The patient would actually complain that they're lying flat on their beds and they seem as if the room is moving. That impulse now, this is where the semicircular canal controls movements, and the understanding of the brain to interpret movements of the room or movements of the environment does not mean, movements of the head doesn't mean the environment is moved. That impulse now is transmitted to the cochlear nerve, and then that's transmitted to the brain where it's interpreted. So deafness in itself, whether it be sensorineural deafness, which involves the nerve itself, which can involve the cochlear nerve, which is the one that actually makes us hear and takes the interpretation to the brain. Deafness in itself is not just a unifactorial thing, because we can see where it can occur from all the way down to the external ear. Anything that impacts on here, whether it be fluid, infection, or a foreign body, injury to the tympanic membrane, whether it be due to an infection or a foreign object, any cause that is, whether it be from swimming and chronic ear infections or high cholesterol that can cause the bones to fuse, to anything that can involve the tympanic nerve itself. We can also get deaf or fullness in the middle ear if the eustachian tube is blocked. In fact, how you hear is basically because the pressure on this side and this side is the same on the tympanic membrane. If this is actually blocked, then you get a sense of fullness within the middle ear based on a simple fact that you feel the pressure only on this side because there's a negative pressure in the eustachian tube. So the entire hearing mechanism, in response to this young lady who asked me, Doctor, can you explain to me why my dad is deaf? In one line, it was not that easy to explain to her that her dad was deaf because of the high cholesterol that actually caused the fusion of the three bones that are supposed to actually amplify the sound. It was probably easier for me to explain to her that her dad had a lot of wax in his ear and we need to remove the wax to enhance his hearing. Yes, it did help with his hearing, but it did not correct his hearing. It was established that he had a deafness to a fair degree that he probably did not need to have a hearing aid at that stage yet. But definitely there was a decrease in hearing at that stage. And it was not a fact that he was ignoring his wife or ignoring his children. He had just managed to be getting deaf. Probably in our kids, the most common cause of deafness are infections. In our elderly, acoustic neuroma, which is also a tumor of the acoustic nerve, can also cause deafness. Within that scenario lies all the infective processes and the common diseases that sometimes we suffer with, that can also cause deafness. So deafness in itself is not just a simple diagnosis of saying, oh, you can't hear, here's an hearing aid, or let me treat your ear infection, or let me remove your wax. It's a little bit more of a thought process than that.